Welcome to Uncluttered and Unfiltered, the podcast urging you to let it go and don't look back. With nationally acclaimed professional organizer Christine Stone and self-proclaimed hot damn mess radio and TV personality Eden Kendall.
Welcome to our Valentine's Day special of Uncluttered and Unfiltered, the podcast where we say it's welcome, everyone's welcome, but if you're over 50, you have found your people. Christine Stone of Neatly Designed is a professional organizer. I'm Eden Kendall. We have a special guest we'll introduce shortly. But we have been teasing this for a while. For our Valentine's Day episode, we are going to talk about it. We're going to talk about sex over 50.
Yes, we are.
But we're not going to just sit here and talk about it amongst ourselves. No. The doctor that is joining us, the physician, she is actually my OBGYN, and she's wonderful. She has held my uterus in her hands, and she has been... Okay,
here we go.
There's no such thing as TMI in this episode. I'm just going to tell you.
I know. I have to get the giggles out.
Get your giggles out, because we're going to be talking about sex. We're going to be talking about sex toys. We're going to be talking about arousal.
Okay.
The word orgasm might come up.
Okay.
Are you turning red?
I'm ready. I've been anticipating this episode, so I'm ready.
Dr. Rebekah Richmond, welcome.
Hi, girls. Hey. I'm excited.
Well,
nice to meet
you.
Nice to meet you.
Let's get right into it, because sex over 50, if you were to ask somebody in their 20s if that still happened, they might even say, what? That happens over 50?
It does. It can. Yeah.
And so do you find that this is a concern of your patients that are over 50?
So it's a big complaint for sure, and honestly, really starts in your 30s. Our hormones start to change in our 30s. And then average age of menopause is 51. So, hormones drastically change at that point. And it's a big question, big concern.
Now, hormones is certainly a big reason for it. There are probably a lot of other reasons too why somebody's sex drive would wane that are beyond that. But let's focus in on the hormones. Is there one particular hormone that drives it, without getting too technical?
So yeah, you're right. Absolutely. There's a 1,000 reasons to have a low libido or a low sex drive. But after 50, yes, our estrogen and progesterone in our bodies starts to decrease. And with that decrease, it's really estrogen driven. With that decrease in estrogen, then a lot of things start to happen. Okay. Yeah, mainly we get some vaginal dryness, which is kind of the beginning of the end.
Yeah.
Bum, bum, bum.
Yeah.
Right. And so, as our bodies are made to procreate, and after 50, we don't procreate. So the thought process, why should we want to have sex if we can't procreate? But clearly that's not the case. And so we have ways around that. We have ways to give back estrogen and help improve that.
What about for the women who can't use estrogen, either due to breast cancer linking or, anything? Is there anything beside, because I think estrogen, like she said, plays a huge role. So if you can't supplement it or do anything because of a cancer family history, is there anything else?
Yeah, great question. So estrogen certainly is our first line therapy, and we do have very low dose, minimal amounts of estrogen that we can often give in the vagina, even in patients that have breast cancer.
Okay.
But beyond estrogen, our really first go-to is to make sure patients know you need lubrication, and that's the main thing to start intercourse going. And so I always tell patients, sit with some lubrication by your bedside, put that on before anything starts to happen, bring it into foreplay. Just make sure you have a bottle of lubrication. My favorite is Uber Lube. You can buy it on Amazon. It comes in a beautiful plastic.
Why is it your favorite?
It's the base for the lubrication, makes it easier, not as sticky, doesn't get dry. When you've been at intercourse for a while and it starts to get dry, and then you got to add more lubrication, then it's just sticky and nasty. It takes you out of the mood. So Uber Lube's a really good lubrication. For maintenance therapy in patients who do have breast cancer and want to stay away from estrogen, we use some products with hyaluronic acid in them. The hyaluronic acid builds up that collagen in the vagina, so just helps again with lubrication, natural lubrication. And it's little gels or inserts that you use about every 3 days. And it's maintenance. You got to stay with it.
So don't buy the hyaluronic acid off the face area at CVS. You're talking about it should be a
totally
kind?
Different. Nope, good question. Yeah, no, it goes right into the vagina. It doesn't burn. It's just, I know it sounds a little caustic, but it's not. But it does. It builds up collagen. So it's a really good option.
Is there a Viagra for women?
That's a great question.
Don't we need that, right?
Right.
No, there's not a Viagra for women. We are very complicated human beings. And so, unfortunately, it's not that easy. It's not that simple. There's different parts of our brain that lead to different parts in our vagina and our clitoris that really require stimulation. And so it's not as simple as giving Viagra. There are certain medications that we can use that are geared towards libido. One on the market right now is called Addyi.
Oh, I heard about that.
Yeah. So Addyi's an option that came over to the U.S. from Europe quite a few years ago, and came with a few warnings, which we've been able to take away. And it works sometimes, but you have to have realistic goals. It's not going to make you want to have sex every day again. Right. But if we're at a once a month and we want to get to a once a week, it might be something that's an option.
Well, there you have just stumbled upon another big question. What is the right amount? And let's say, now obviously it's different if you're single and dating, or if you're a married couple, and if you're newlyweds. And I mean, every family is different. But let's just go with, you're in your 50s, you've been with the same partner for many, many, many years. Is there how many times a week is normal, or is that just a dangerous thing to even consider?
It's different for everybody. But, and it depends what works in your relationship. And let's face it, the men are sometimes going through some changes too. And so really it's a conversation to have with your partner. On average, I will say, when we've done the studies and we looked at testosterone in the past, when we've done all these studies, we have found with intervention, we're looking at more sexually satisfying episodes per month. And so the interventions often improve sexually satisfying episodes by 1 to 2 times per month. So on average, I would say once a week, sex is something that works for both partners.
Okay. And the interventions you're talking about is, actually sitting down and really discussing, really thinking about it, maybe adding a hormone, adding a different kind of lubricant, the hyaluronic acid, those kind of things?
Starting with vaginal health first, get that in tip-top shape with good lubrication, because, if you're having pain from vaginal dryness, and who's going to want to have sex? Right. So, and some of those interventions, the vaginal estrogen can bring more blood flow back to the clitoris. So, I often ask patients, once you do start having sex, are you able to achieve an orgasm? And is that orgasm just as good as it used to be? Because sometimes those go away. Those go away too.
Well, that is my question. It seems like, I know, and this is probably estrogen related as well, but desire, when you don't feel desired, or you don't feel like, you felt like when you were in your 20s, 30s, 40s. And so the desire kind of wanes. Is that also estrogen related, or is that mind related?
So that's a good question. It's a lot. Yes, I would say primarily estrogen driven. But in our 50s, maybe we've been with our partner for a while. You got to still want to have sex with your partner. So if you reach that point where, you got to still like him. Mm-hmm. So that's the first aspect. So we do a lot of behavioral modifications, date night, have a few glasses of wine. Quite often I'll have patients schedule sex. So I always tell them, either Freaky Friday or Sexy Saturday, you pick one, and just know that we're going to have sex. Have your partner know this is the night. It's not that, oh God, is he going to tap me on the shoulder?
Right.
Is he going to want to have sex tonight? You know it. If Friday nights are for sex. And so once you know it, it kind of takes that pressure off of your partner, because he knows they know they're going
Right.
to get it. You know what to expect. And then sometimes too, as a woman, if maybe you're getting a little frisky and your partner turns the other way, boy, what a blow to our ego.
Yep.
So, if you schedule sex, I know it doesn't sound fun, but that scheduled sex actually can help get that body more used to, okay, here we go. Yeah.
That makes sense. It makes a lot of sense because sometimes if you then you don't run the risk of the rejection feeling
Right.
the other days,
For either one of you. But so that's a little bit of the behavioral modification. Absolutely 100% buy a new vibrator. I tell all my 50-year-olds, you got to get a new vibrator.
Okay, note to self.
Let's talk about that. Let's talk about that. Why do you tell that to your women of all ages that come see you?
All ages. I love my little young girls who are just now becoming sexually active because no one says to the young girls too, hey, listen, sex is not about the boys, it's about the girls too. And I mean, let's face it, boys are pretty dumb. The clitoris is really high and they just, it needs to get, you miss it. You need to get that stimulated. So at a very early age, you need to learn how to self-stimulate the clitoris as well. So, and the vibrators are important because most of us as women cannot achieve orgasms with intercourse alone.
So that whole G-spot thing that used to be in the 70s, they used to always talk about in movies and whatever, is that real?
It's never been in any of my medical textbooks.
Okay.
Yeah, I feel like that's been overrated a little bit.
I do too. I mean, because for me, I'm like, outside stuff is the best.
Yeah, it's the best. Now there are nerves and everything that make their way inside the vagina as well, for sure. So, but knowing yourself how to stimulate, that's really important. And then the vibrators, that's what they're there for. And there's hundreds of different vibrators out on the market nowadays. And they're really fun to test and try and find the one for you. But there's some with some clitoral sucking mechanisms. Those are a bit powerful. And then there's some, the little pocket vibrators. That's all they do. They just provide a little vibration. But, it does a couple things. Gets you stimulated, number one. But number two, you tell your husband, I'm getting a new vibrator. Oh, my God. That's that in itself is going to help your sex life.
Oh, just telling him that.
Just letting him know that. That's right.
So, couple of thoughts I want to mention on that. Have you seen the show on Netflix, Grace and Frankie?
I've
Jane
heard.
Fonda and Lily Tomlin. Well, one of the seasons was all about how they invented a vibrator for women who were senior citizens because their arthritis was making it difficult for them to use.
Funny.
So they had a whole thing about that. Of course, I think they're in their 70s on that show. But I thought that was funny.
That's
great. And then another thing is that, they have all those parties, or they used to. It used to be a bigger thing, I think, in the 90s and early 2000s, where people would have those parties, like a Tupperware party, but for sex toys.
Yeah.
Oh, yeah.
And so they were selling a hairbrush that vibrated, and everyone's like, at the party. And they were like, that is so that if someone hears through the door the vibrating sound, you can open up and be like, it's just my hairbrush.
Oh my gosh, that's great. I have to say they've come a long way with vibrators. And so, it's not your mother's vibrator anymore.
Yeah, I feel like people think, when they think of a vibrator, they think of I'm not like trying to pander or get, gross, but there's the word dildo, which to me always means something that you stick up there.
Right.
And then there's like outside. So there's different, different kinds.
Yep, lots of different kinds.
I think that's a big tee-hee-hee and very personal. Like, I rarely have conversations with other women about that kind of thing.
Yeah.
But it's something that could be normalized, I guess.
Yeah.
But it's really not that.
They sell them on Amazon now. In fact, they sell them at your local CVS as well.
That's right. That's right. They do. So there you have it. So, okay, we've covered how often. We've covered some of the medical reasons why and some of the psychological reasons why. What about, and I know we have a lot of people listening right now that are, and I actually looked up some questions women over 50 might have about sex. And so I know for a fact we have some single women. And so once you know that you're not going to get pregnant anymore, do you still need to worry about condoms and birth control? And I think the answer would have to be yes because of STDs. But you
absolutely, yeah. And it's an interesting topic to bring up, especially in the wake of HPV and what to do with abnormal Pap smears and that kind of thing. And so, yes, a lot of times I have newly divorced women who are coming in and maybe interested in starting to date. And so I tell them, you know what? Hey, listen, the Gardasil vaccine that we give to our young girls to help prevent cervical cancer is something that I would consider in any woman going through a divorce that's going to have new sexual partners. So you do still worry about STDs. Mm-hmm. So condom use, yes. Birth control, nope. We've come out of that. Yeah, as long as you're in official menopause. Now, we have to know that you're in menopause because you can get pregnant at 50 if you're still ovulating.
Oof. I'm way past that. Thank God.
I liked oof. Yeah. Spelled OOF. Yeah. But if that's not, on your agenda to have another baby over 50, then yeah. So did you have anything else?
Well, I think a lot of it for women over 50 is also psychological. Either like you said, they've been divorced and they're getting back out there again. And it's such a different world now. I mean, it's the dating apps and, a lot has been talked about porn and what men see versus what's real.
Right.
And that, I think, psychologically has hurt women only because they're being compared to something that really isn't realistic.
Right. Absolutely. And let's face it, in menopause, our bodies are changing. And peri and premenopause, our bodies are changing. Metabolism changes. And so, it's psychologically, it's a hard thing, a very difficult thing for women to see in the mirror. And what starts our desire is how we feel about ourselves. So you're absolutely right. And it is tough.
Let's talk too about vaginal rejuvenation, which is, I think it was a TV show I was watching or something. I mean, I get a lot of my references are just from fictional TV shows, so you'll have to forgive me. But in this particular episode, there was a guy talking about how he's out in the dating world, but if they've had babies, they better have had the surgery, the vaginal review. But I think about that, I'm like, oh my gosh, how would you know? If you were all of a sudden thrust back out there, I wouldn't know what the expected body hair situation du jour is these days. Mm-hmm. I wouldn't know if I'm, tight enough, you don't know.
No, yeah, these are all things that go through everybody's mind. And so not just in newly single women and starting to date, but in all women, my gosh, is my vagina tight enough? What's going on down there? So, in menopause, once our bodies lack estrogen, actually things do go in the opposite direction. Yeah. And unfortunately, we get a little too tight sometimes, and it becomes painful for us as women, which is where that vaginal estrogen comes into play, where the lubrication comes into play. But along the lines of vaginal rejuvenation, gravity is going to take effect everywhere. And our labia does change. Our labia majora starts to droop. Our labia minora, that's the smaller lips on the inside, get a bit bigger and they hang more and they can get in the way. Or some women just worry about what it looks like down there. And can we fix that? I mean, yeah, there are some surgical procedures we can do to help. I always try everything else before that because, you're cutting on nerves that are pretty important down there. But there are things that can help, certainly. If it is a psychological barrier, then let's take care of it, because if you're going to have better sex because you've gotten past that barrier, then fine, we'll do it. But there's new products out on the market. Mona Lisa, I don't know if you've heard of that. These vaginal lasers. At the end of the day, they're all there to stimulate collagen because it's that collagen stimulation that tightens and firms things up.
So when you're watching these shows and they're showing you the lasers that you sit on the chair and all of that, that actually does have a...
So the chair, that's a lot for some urinary incontinence to build up muscle floor and get that nice and tight.
I see.
So speaking of the pelvic floor, could that have a big bearing also if your pelvic floor is out of whack or not strong? can that have a big bearing on sexual intimacy?
It can. Now, again, if pain is part of the process and the barrier for sex, then yes, for sure. And, it's a vicious cycle. If you have pain when you have sex, then it affects your brain, and why in the world would you want to have why would you want to do something that causes pain? So the pelvic floor can play a role, and we do have great pelvic floor physical therapists here in Jacksonville that can really help out with that, and they get up close and personal for sure, and they use a lot of good biofeedback, but the pelvic floor physical therapy can help really work those muscles. And I always tell my patients, you've got a personal trainer for your vagina. And that's what they do. If your bicep's weak, what are you going to do? You're going to go work out your bicep and build that up. Same thing with the pelvic floor. Absolutely.
And are Kegels really as important as they say?
They are. I mean, it helps with the musculature for sure. Kegels, it goes even beyond, Kegels, really. And there's some good biofeedback you can do to figure out which muscles to strengthen. Sometimes you can over Kegel, actually. And that can create a little bit of tightness down there that's unwanted. So there's a fine line there, but yes, absolutely helps.
And one other thing, I know this is for women over 50, but if you've been married a long time and you have a spouse that's over 50, I feel like, menopause is a real thing. I don't think men ever in a million years will ever talk about it because they just won't. But I think that women sometimes can get a bad rap when it comes to men not having desire either, or men not wanting to talk about the changes going on in their own body. And then that kind of leads back to how a woman is feeling.
Right.
Because we all think everything's about us, or, that we're doing something wrong, or blah, blah, blah. But I do, from women of my own age, it's a thing.
Yeah, it is. You're absolutely right. And so sometimes that's where that scheduling sex can help, because maybe they do need a little Viagra or a little help there in their department. And honestly, it's much easier to help that department than it is to help ours.
Right.
So, but they do have to have the courage to talk to their physicians as well. But it gets a bit turned around on us.
Right.
And so, the boys are a little bit trickier when it comes to admitting there's an issue.
Yeah.
Now, not every gynecologist is as researched as you are on this. I mean, you've really made this. You're a very forward-thinking, very sexual positive. I don't know how you would describe that. I mean, although you've, like I said, you perform a hysterectomy, you've delivered so many babies in Jacksonville, but this is something where you really have honed in, and you're very open and willing to talk about it and passionate about it. Is that, do you think that's rare, or do you think that's common?
Well, I think, when we're going through residency and through training, we're trying to keep our head above water. We're trying to learn everything there is to know about keeping women alive through childbirth. And we don't focus a lot on menopause. So, we're doing a little bit better job now, but I think it's kind of, you learn yourself. And let's face it, I'm a woman too. And unfortunately, I went through menopause at 39.
Oh, wow.
So I had to figure a lot of things out on my own. And I think I've told Eden before, if it's out there, I've tried it.
Yeah.
I try everything to see. And there's lots of different preparations that come with risks. Any intervention, you're going to have risks and benefits. Yeah. And I think testosterone's the new big one that everybody's hearing a lot about and a lot of interest in. And testosterone in high enough doses, it works. I mean,
But do you get the side effects like the acne and the growth of the hair, facial hair?
Yeah, the clitoris can get bigger. You can, which isn't, it's not a terrible thing to have a bigger clitoris if it works.
But that can help.
It can, the testosterone can help. Unfortunately, it's not FDA approved for women.
Okay.
So we don't have a formulation for women for testosterone. It was studied years ago. There was a beautiful article in the New England Journal of Medicine that actually showed some possible risks with testosterone. So we really, again, not always our first line therapy, But and it depends where you are in life. If we're in a new relationship in our 50s, or if, or if it's something that's affecting our sex life and affecting our marriage, then absolutely something we may want to try. Now, this may be different in our 70s or 80s. I have an 80-year-old, though, who comes in very sexually active. She's a hoot, and so she doesn't want to let go of any of her hormones.
God love her.
I know, right?
Yeah.
So
I know you can't really talk in specifics. Is she single? Is she dating around? Or like what's
she's dating.
Okay.
She's dating.
All right.
Gosh.
No, I know that's none of my business. I just kind of think,
Love
Wow.
her. Love her. Yeah, I know. Goals. Gotta have goals.
Gotta have goals.
Exactly.
Right. So, but the testosterone's a good one, and so I've been through it, and I think maybe that's why I feel so passionately about it. There are some true medical organizations in the fields of gynecology that have meetings every year that I go to, and so we deal a lot with sexual health, and it's more out there and it's being spoken about more, and I think as women becoming more and more important in society, that it's getting a bit more studied and evaluated, and we're getting a little more help there.
I feel, pardon me, fulfilled by this podcast. Because
very interesting.
I think interesting choice of words. No, I feel like we've checked a lot of boxes.
Yeah.
And at the very least, it might inspire someone listening to reach out to their physician
absolutely.
or
See what's available for them.
see what's available, or, maybe feel more confident in pursuing some of these interventions.
Right. I would caution some, because there are some stay young and rejuvenated clinics out there.
Yeah.
Be careful. Yeah. Talk to your gynecologist. They should be well studied in these areas and able to provide benefit risk ratios to everybody.
And you'll know if they're not. Like if you're in the conversation and it doesn't seem to be as expansive of a conversation as what you're hearing right now, if now that you know what the possibilities are in speaking with a physician who's actually put in the time and effort and passion to study it, now you have a basis for what you're looking for in a doctor to discuss this particular subject with.
Right, and maybe set aside an appointment just for that, not as a physician's walking out the door. Hey, do you have anything for libido?
Right.
It's a great visit.
And also, I took away everybody's different. I mean, every age is different. Every woman feels different. Some people, like you said, may struggle with something and some women don't. I mean, everybody has different feelings going on or different expectations of what's going on. Married, single, divorced.
Right.
There you go. And in another episode of our podcast, we talked about Christine's mom in her 80s, and she's a social butterfly. Do you think we should sit her down and ask her?
No, I definitely do not. I definitely do not. Something I don't want to hear.
No, definitely not. Nope. Dr. Rebekah Richmond.
No.
And where can people reach out to you? I don't know if you're taking new patients. Certainly this wasn't about that, but where can people find you?
I'm at Beaches OBGYN out in Jacksonville Beach. Happy to take new patients.
Okay, very good. And we appreciate that. And we close our show kind of the same way. We ask everybody to do all the things that you do with podcasts, like subscribe and give us 5 stars. And, if you mean it, if you truly mean it. And if you recommend to a friend, that's great. You can share this podcast with somebody specific. You might want your husband or boyfriend or partner to listen to this too.
Yeah, this is a great Valentine's Day gift.
And I know this is late in the game for me to bring this part up, but I feel like it should be said that there's a lot of this that applies to same-sex relationships as well.
Absolutely.
So I want to make sure that we put that out there as well. And having said that, it is time for us to say to you, you can let it go.
And don't look back.